question. Right. So if you have read and understood, considering a clinical examination session, can we begin?
Good morning. I will enter a wash. I will sanitize my hands.
Can you bring mic closer to your?
Okay.
Thanks.
Okay. Can you hear me now? Okay. I will walk in. I will wash my. I will sanitize my hands. Can you hear me now, better, man? Hello.
Yes. Yes. Yes.
Can you hear me better?
Yes. Continue.
Okay. Okay.
Now it's
I'm
better.
Dr. Fabian.
Yes.
Okay. I'm Dr. Fabian Olisa. I've been asked to examine your nervous system. It will involve you taking a walk, and then I'm going to look closely at your hand and ask you to walk, also your lower limbs. I don't know if you are comfortable with that.
Yes.
Okay. Before we move any further, I would like to confirm your name and your age, please. Okay. At this point, I want to know, do you have pain in any part of your body?
No.
The patient will tell me, okay. I would like you to take a walk, to stand up right now from your bed, and I would like you to take a walk to the wall and back for me, okay? As he walks, I will look out for any I'll look at his gait, whether he has any ataxic gait. I'll tell him to walk back. As he walks back, I will also watch his gait. As he's walking, I support him. Then as soon as he gets back to me, I'll ask him, okay, can you close your hands by your side, please? And you close your eyes. I'm going to assess for your stability at this point. So he does that, and I'll also put my hands by his side to be sure he's not going to fall off. Okay, you may open your eyes now. Okay, at this point, I want you to stretch out your hands for me. Okay, he will stretch out his hands. I will tell him again, you are going to close your eyes. I want to also assess for the movement in your hands. So I will watch out if there's going to be a pronator drift that will be shown as the one of the upper limb drifting away from the other one. As he does that, I will also ask him now to open his, leave his hands stretched, while I'll put my hands on top of, or over his own hands, and put a gentle pressure down in his hand to see if there will be rebound, to demonstrate the rebound phenomenon. Okay, once that is done, I will ask him now, okay, can you take a walk heel to toe to the wall and back? So he will do that with his hands again stretched out this time around. So while he does that, I also put my hand by his side. Okay, he will do that and he will also come back to his bed. So I ask him, okay, at this point, you may sit down. I will get a seat and put it at the same level with him. I'll ask him, at this point, I'm going to be looking at your eyes. You look at my eyes directly. Please do not move your head, please. Okay, I'll bring my finger to between us and ask him to follow my finger, and I will make the H sign to this side, to one side, to the left, and then down, up and down. Similarly, I will also do the same, looking out for nystagmus. Then after this, I will ask the patient, okay, can you open your mouth, please? When he opens his mouth, I'll tell him, can you say, ah? Okay, he will open his mouth and says, ah. When he does that, I've assessed for cranial nerve 9 and cranial nerve 10. Then I'll ask him to say British Constitution. British Constitution, he will say it like twice. I will assess if there is any staccato speech. Okay, I will now ask him to shrug his shoulder. He will shrug his shoulder, and I will put a little gentle pressure to see the tone as he shrugs the shoulder to assess for cranial nerve 11. I would now ask him to, I would have asked him to protrude his tongue when he opened his mouth to assess for cranial nerve 12, which is the hypoglossal nerve. At this point, I want to examine your upper limbs. Okay, I'll tell him, do you feel pain in your joints at this point? He'll tell me no. Okay, I will hold the hand and hold the elbow and lift it gently and feel and check if there is any resistance as I move the hand upwards gradually. Okay, I want to check if there is any whether there's hypotonia or there's rigidity as I move the upper limb. Then after that, I will tell him I'm going to use this this thing I'm holding to check for the reflexes. Your limb is not going to be painful, so I will put it and hit it over my finger. Is that okay? All right. So I will check for biceps reflex. I will also tell him to put his arm over his chest while I check for the triceps reflex. While doing this, I'm looking at the triceps muscle. When I'm doing that for the biceps, I'm looking at the biceps. So I may roll the sleeve of his arm upwards to be able to assess that. Then once that is done, I will tell him, okay, I'm going to sit in front of you now. You follow, and I'll be a little away from him. Look at my finger, okay? You touch your nose and try to touch my finger, okay? The patient will do that, all right? As he's bringing his finger, the first one I will allow him to touch. Then once he's coming to me again, I'll take it a little further to assess for coordination of his upper limb or to assess for this diadochokinesia. Then I will tell him at this point, you may have to lie down on back to your bed. So he lies down on his bed. I will do a roll of the whole lower limb. Once as in leg roll, I will leg roll the lower limb to check for the tone. So I will now lift the lower limb.
Yes, present your case now, your examination, please.
Okay. If time would have permitted, I would have completed the reflexes of the lower limb and then check for coordination of this patient. I would have also want to examine the complete neurological examination of this patient and do a full upper and lower limb examination.
Very good.
I've examined this gentleman who has been on admission for a strong hoarding disorder. On my examination, I noticed that he has this diadochokinesia. He has an ataxic gait on walking. There was nystagmus noted in his eyes, and I also noted intention tremor, his staccato speech, and the upper limb was hypotonic. I couldn't assess the lower limb completely because of time.
Very good. So what are your differential diagnoses for this patient?
Okay, the differential diagnosis, my differential diagnosis could be a primary or a secondary cerebellar lesion. Secondary cerebellar lesion could be as a result of metastatic tumors to the cerebellum. The primary lesion could be a medulloblastoma, an epidandiomoma, it could be a choroid plexus tumor.
What else would you consider?
Another thing I can consider that is non-neoplastic could be a cerebrovascular accident. It could be a transient ischemic.
What investigations can you suggest for this patient to confirm your diagnosis?
Investigation to confirm my diagnosis would be an MRI of the brain with a gadolinium contrast. A plain X-ray can also be done, but it may show calcification. CT scan can also be done in this patient, but MRI has been shown to be superior.
Yes. Why do you think MRI is more diagnostic than CT brain?
MRI is more diagnostic because we are assessing, MRI is more sensitive for soft tissue. The CT will show mostly bony lesion, and it may be an artifact or show some distortion in the assessment.
All right. Yes. If you confirm your diagnosis, what would be the treatment that can be offered to the patient?
I want to offer, if it's a tumor, I want to offer an excision.
Good. Very good. So, right, in the beginning, when you begin, you did the Romberg sign, and then when you asked for the gait, you did both or one, heel to toe gait, or you did tandem gait as well?
Yes, I did It's tandem I did, ma'am.
I think you asked the patient to heel to toe gait. This is what I think. Okay. And when you were doing head and neck examination, did you make sure to check glossopharyngeal and vagus nerve examination by asking the patient to do open the mouth? Okay.
I did. I
I'm
said,
sorry. Yes. And
ah.
Glossopharyngeal nerve, like with tongue protrusion?
Yes, ma'am, I did.
All right, good. You did check the tone, you did for upper limb and everything. So yes. Intentional tremors also. You check. Did you ask the patient to stretch out the hands, and did you look for the intentional tremors?
Yes, ma'am. Okay, intention tremor.
Yes, no, I think you didn't.
I didn't do that. I didn't.
Yes.
I didn't.
Reflexes you did, very good. Rebound phenomena you were checking. Right. And low limb, you did complete. So from my side, it's pass. Very good.
Thank you, ma'am. Thank you.